Where's everybody?
Matt and Liz, we had a crazy morning. A lot of people showed up. They're finishing up. They'll be here soon.
Okay.
So I just
Well, we got to get started. The other folks are waiting on us, so I've got an appointment after this. So.
Oh yeah. Well, we do it,
Okay, so today we're going to talk about how to write case studies. It's not the most exciting lecture you'll attend, but I do this once every 2 semesters to give interns who are interested in writing case studies a little background because it's not something that you get otherwise in the curriculum. So most of this material, this presentation and the paper that I got it from is Spark Green, and Dr. Claire Johnson wrote a paper, a great paper that is actually referenced in lots of literature on how to write case studies or case reports. And so that paper is also posted on Signet. Just a reminder for our 10th try interns, there is a exit assessment that is posted on Signet. I've emailed all the clinicians, but that needs to be filled out and sent to me. It is anonymous. You'll see that I ask you to put your last name and your first initial on the assessment, but that's just for tracking purposes. I then delete your name before I send it over to the research folks. Moving on, if anybody has any questions, just ask or chat and I'll answer. So there might be a slight lag. I'm going to try hosting this entirely online. So rather than using PowerPoint, I'm going to see if there's less lag with WebEx if I host this entirely online. So this is a Google Docs. The purpose of why it's important to write case studies, why would anybody care about writing a case report? And the answer is, if we think back to the evidence hierarchy and we think about the pyramid, we know that systematic reviews is at the very top of the pyramid. That's the pinnacle of the research design. And the base of the pyramid is non-empirical expert opinion. And expert opinion has its place, obviously, in evidence-based practice. It's a third of evidence-based practice triad. But just above expert opinion is the first peer-reviewed section of that pyramid, and that is case reports and case series. And metaphorically, it represents the foundation of the pyramid. However, case reports are the foundation of the published literature. And so the point being that we can't run larger controlled trials on a hunch. And so nothing ever gets funded just on a hunch. And so case reports serve a variety of purposes, but one of them is to get the ball rolling on particular topics of research. And we are in a field that is under-researched. We need a lot more research, not a little bit more research, but a lot more research about what it is that we do from basic science mechanism of action all the way up to we still have gaps in the clinical literature. So an example of this, the jury is still kind of out whether spinal manipulation helps neck pain. Now, any chiropractor or any chiropractic patient who's ever had neck pain will say that it helps. There's very, very little question if you ever talk to a chiropractor, does spinal manipulation help neck pain? But we don't have enough evidence yet to make a definitive, it definitely helps. So now low back pain guidelines say that spinal manipulation should be a first-line intervention for both chronic and acute low back pain. The same for headaches. And for chronic neck pain, we've got enough evidence, but for acute neck pain, the jury's still out. So it's one of those, there's not enough evidence out there yet. And so that's just an example of we don't even have neck pain covered in the research yet, and we do a lot of other stuff. And so we need a bigger foundation. Another good reason to write case studies is we talk to each other. And if you find something neat in clinic, the first thing you do is go tell your peers about it. You go talk about it. And a case report is an excellent way to inform us your colleagues in the field, not just at a local level, but on a national and international level. So if you see something cool that you think is worth telling your friends about, it's probably worth telling others about if you care about our profession. The AMA reprinted 51 papers from JAMA that were published in the last 150 years, and 5 of them, and these were the most influential papers that were published in JAMA for the past 150 years, 5 of them are case reports. And so case reports, even though they're not anywhere close to the pinnacle of the research design, they significantly contribute. Slight technical. Sorry, folks. Okay. So back to case reports contribute significantly to the research, and we inform each other with them. And I asked this question for the future of our profession. A lot of you are unfamiliar about how tumultuous the practice of chiropractic is, and you're about to find out that we live in we practice in a very, very divided profession. There is a lot of internal struggle from within our own profession, and so I think national feels that it's imperative that we become aligned with and part of mainstream healthcare. But we are divided on that as far as the profession goes. So there are a small minority, but with a big mouth, that feels like we should not be part of mainstream healthcare. And I personally feel, and I think the goal of national is to make us integrated with our healthcare system and a part of mainstream healthcare. And research, including case reports, is key to becoming integrated in our mainstream healthcare system. We cannot move forward being an under-researched profession. So we need research to back up our interventions. We need research to back up our diagnostic procedures. I asked this question, are we doctors or are we technicians? I feel like if all we want to do is crack backs, that can be trained at a relatively minimal level. But if we're doctors, if we're teachers, and I think most of us would feel that our training is indicative of being a teacher and a doctor and not just cracking backs, then research is a part of that. And so while only a minority of you are interested in publishing research, case reports is a very, very easy way to get involved in the scholarly activity and contribute to the scientific literature from your practice. It's hard to run clinical trials in your practice, but it's easy to run case reports and case series. And I already mentioned to 4 of our colleagues in our world, I feel like it also improves our credibility as a profession. The more research we have to back up what we do, the better our credibility is, the less we have to defend ourselves. And it also will give you instant credibility with your patients. When you see a new patient, you have a very, very small window of time to make that impression. And once that window closes, the patient is gone and they decide whether or not they want to come back for their second visit. If you're a published author, that gives you instant credibility because a lot of patients aren't even used to their general practitioners being published authors. So it gives you instant cred. Contributing to the research legitimizes and broadens our scope. So if you feel like you would like your practitioner's scope to be broadened, which we've already touched on a little bit, contributing to the research is important for that. The broader the research base, the broader our scope will be. And that's not just from a legislative perspective. It also has to do with research and research in what insurance companies rely on for reimbursement. So reimbursements are based a lot on research outcomes. So if there are clinical guidelines saying this is appropriate, the probability that an insurance company is going to get by with not reimbursing for it is slim. And a good example is Illinois is a pretty broad scope state, and so we have pretty broad insurance coverage and pretty broad insurance coverage legislation. So you can build diagnostic tests here, blood work, allergy tests, etc., and it's likely to get paid if it's an Illinois plan. But we just 2 weeks ago had a case where a patient, we saw them maybe 12 times, and we were treating her neck, her lower back, and her TMJ. And as a fifth diagnosis, had temporal mandibular joint dysfunction. And the plan was out of New York. And in New York, apparently the scope is not as broad. And the insurance company said that chiropractors, that treating the TMJ is outside of the chiropractic scope. And they flat out denied all our claims. So even though it was only the fifth diagnosis on the list, they denied all our claims because they said treating the TMJ is out of the chiropractic scope. So we're appealing that, obviously, but that's an example of where our scope needs to be broadened. And I think TMJ is a great example of something that we do as good as anybody else. TMJ is tough to treat. But I think we do it as good as anybody else, and therefore we should be reimbursed for it. If an insurance company is going to reimburse anybody for treating the TMJ, then they should reimburse chiropractors because we do TMJ fairly well. So, but we need a research base to support that. Okay, so what makes a good case? Obviously, we know that a good case is a unique intervention, a unique response to an intervention. So something unexpected makes a good case, and I think that's inherent for all of us. We understand that if you see something cool and something responds well to it, that makes a good case. However, don't limit yourself to just those unique cases that respond well to something you're doing. Adverse effects, those make good case studies. If you notice that, let's say you're into McKinsey, if you notice that every time you've got a cervical disc that peripheralizes with a particular movement, if that's part of the protocol, but you notice every time you do it, and maybe I shouldn't have named McKinsey, if you just notice that every time you do X, it causes the symptoms to flare up rather than resolve, that makes a good case study because that would inform us all, hey, I've noticed a trend in the last 10 patients who had, upper extremity radiculopathy. Every time I have them do this, their symptoms get worse and not better. That makes a good case study. Anything you think that would inform us. Let's say you've come up with a new diagnostic test, new orthopedic test. Orthopedic tests exist almost exclusively as case studies initially, and sometimes they never make it past that. So an author will say, hey, I noticed that every time, I think a great orthopedic test is slump 8. When I went through school, slump 8 was kind of referred to as a useless test, but I would disagree because I've noticed that patients with specifically neck disc issues, without radicular components, if they sit and you've got a positive straight leg raise, it's very, very specific to cervical disc. And so somebody noticed that initially and published it and came up with the orthopedic test slump 8. And so anytime you notice something new, and I thought about publishing on this because that's something that maybe you're not exposed to going through school, is that if a patient with neck pain that's not radicular, if sitting provokes their symptoms and they've got a positive straight seated leg raise, then it's indicative of disc. Maybe you weren't exposed to that. And it's very, very specific. If you've got a positive straight leg raise and it reproduces neck pain, the probability of a disc is very high. And that's anecdotal, but I've seen it on MRIs. So that's an example of something. Question?
With regards to that, compared to a lumbar disc, is it just equally specific, or is it just more, if you're getting the neck pain recreated with like a left or a positive straight leg, are you getting, that's more specific to a cervical disc than to a lumbar disc?
I think so, yeah, because with a lumbar disc, you could get a positive seated leg raise, but that could also be SI or that could also be facet. But if you get a positive, and this is just an intuitive thought process. This isn't in the literature, but if you've got a positive seated leg raise for neck pain, even if you don't have a radicular sign, you've got to think, this could be disc because, really, how else would that, that's a neural tension test. And what you were exposed to you probably were exposed to that a supine straight leg raise isn't that specific, but the confirmatory Braggart's test, right, is much, much more specific. So if you've got a positive straight leg raise without a positive Braggart's, it's of little value. But if you've got a positive straight leg raise, you back off on the pain and then dorsiflex the ankle and it reproduces pain. It's much more specific. And I think seated straight leg raise for neck is very similar. So anyway, that's an example of something that I might have noticed to think maybe this is worth searching the literature for to see, has this been published on? And if not, that makes a good case study. So the point being, lots of things might make good case studies. This is the first time that sun has ever been welcome in this room. It's freezing in here. Okay, so the anatomy of case studies. Case studies are typically retrospective, meaning what? Yeah, you do something, or you see something on a diagnostic test, or you do something in the clinic, and you think, that was interesting, let's publish on it. But case studies can be prospective. And in particular, a case series is a small clinical trial, and that's something you could actually perform in your clinic, is a prospective case series where you say, I want to study X intervention for X outcome, and I'm going to do it prospectively. That makes it interesting. You don't know what the outcomes are going to be, but you hope to see something interesting, and then you could plan on publishing on that. And that does not need to be registered as a clinical trial. And again, it's an easy, you don't need institutional review board approval for that. And the reason that that's important is you're not manipulating anything, right? Well, as chiropractors, we are manipulating things, but you're not manipulating variables, right? So you don't have a control group. You're not manipulating any variables. You're just saying, I want to see what happens if I do this on a series of patients. And I'm going to write down the outcomes, and then I'm going to publish on that. So that's a case series, which could turn into a cohort study. So you could look at a long set of data. Maybe you collect data for years, and you publish on it at the end of that time. However, it's a good practice to get into if you see anything that you think might make a good case study, to get consent right away, because patients will fall off, the edge of the earth. You might never see them again. Most journals want consent to publish on a case unless the patient is deceased. So unless the patient died, you're going to need consent to publish, well, whether it was retrospective or prospective. And that's even if it's just a set of data, even if it's just lab data, they want the patient's consent. And so,
something that you just asked your initial.
Yeah, well, I think National does this to some extent to their intake. So if you actually read the National consent form, I think at least there used to be. Yeah, so there's a consent to publish on National. So that's something, if I were you, I would just add to my intake, and that way you've got that base covered if you ever should decide to publish in practice. So what is a case report? We've all probably seen and read them, but essentially the narratives that you're forced to write are not that dissimilar from a case report. The only thing missing from the narratives that you have to write and turn in for graduation is a research, a literature search. And so in your narrative, you're missing the introduction and the discussion section, but everything else is pretty much the anatomy of a case report. And that sounds easy. However, the literature search is the most challenging part of it, and working the literature into your case report takes a lot of time. But essentially, if you can write a good narrative, you can write a good case report, because I know you guys can search the literature. So almost universally, all case reports have a title, a structured abstract, and the abstract has to be structured dependent on the journal that you're publishing to. But the abstract is just a miniature version of your paper, an introduction, and then not to confuse, but it's going to confuse, there is a case report section of a case report. And the case report section of a case report or a case study is the methods. and I'll discuss in detail in a section. Discussion, conclusion, acknowledgments, references, tables, and then any captions you use. So the title, typically authors, I think most often will work on the title last. The title is one of the more challenging parts of a case report because it has to, in 2 sentences, essentially summarize your case study. So what intervention or diagnosis, the outcome, the population, and the condition, all in one concise, very informative. Would I be interested in reading this summary? And so a lot of authors, I think, will write the abstract first, and then maybe the body of the case study, and then come back to do the title last. So the abstract, we all know the abstract, just like in a clinical trial, is a summary of the case report or the case study. And the abstract is important because in most databases, it's only the abstract that gets indexed into the database, not the full report. So, and let's face it, the abstract is what people read for the most part. 90% of the time, people only read an abstract, and so if not more. And so your abstract often is a good starting point. So I should step back and say the best starting point is a research review. So search the literature first to find out, is what you want to publish on actually news to anybody? And so I use the example, we look at natural standard. I've noticed that when you prescribe vitamin D to patients with psoriasis, it helps. And so you might think, wow, this is awesome. I give high dose vitamin D to my psoriasis patients and they get better. But if we go to natural standard, we'll see this has already been investigated in multiple large clinical trials. And vitamin D and vitamin D derivatives is actually one of the leading frontline defenses in allopathic approach to psoriasis, whether orally or sublingually or UV radiation beds. And so that's a very common treatment to psoriasis. So do your background investigation first and make sure that what you're interested in publishing on actually might be news to people, because if it's not, it might make an interesting write-up in like a dynamic chiropractic or a non-peer-reviewed source, but no journal that's peer-reviewed is going to publish a case report on something that already has large clinical trials investigating it. So once you have completed your investigation into the literature, you find out that nobody's published on this yet, or only a couple people have published on it. That's when you start perhaps with a structured, this is what I want to write about, and an abstract is a good place to do that. So you write a quick summary of what you want to publish on, and that can be your abstract. And you actually see this a lot in conferences. A lot of times at conferences, authors only write up an abstract, and there actually is no paper. They only write a structured abstract and present it at a conference, and then if there's enough merit or enough momentum, they might write the full paper and try to submit it to a peer-reviewed journal. So the introduction. The introduction is where all of your background search is going to be worked into the paper, and it's where you as the author are going to establish the need for your case report. So you're going to take the introduction as your opportunity to say, this is why I think what I found is important. And so, this is going to take a lot of time. Writing the introduction takes a ton of time because you have to first do your literature search, get all your references, and then work those references into the introduction to establish a need for your case report. Why would I bother taking time out of my busy schedule to read your case report? And obviously, you don't. There's no merit in writing up a case report that nobody wants to read. And so the introduction is where you introduce this. Now, it's strictly objective. In the introduction, there's no opinions. So you don't get to insert your opinion to say, I feel like the world needs to know about this. But you can say, nobody in the world has published on this to date, and make the case in your introduction, but make it objectively. The bulk of your literature search is going to be referenced here, and your references generally are going to be referenced at the end of your paper in order of presentation. So the order that they present in the paper is how you're going to reference them. However, different journals require references be performed in different ways, and so some journals actually like footnotes as references, but most journals think that that kind of clutters up the paper. So and we're going to get to that in just a second. Again, the literature search should be very, very, very inclusive, and so make sure that nobody has published on this already. And I'll take this as an opportunity to once again remind you that PubMed is not all-inclusive, especially for CAM stuff. So make sure you search index to chiropractic literature, because there are peer-reviewed chiropractic journals and alternative medicine journals that are not indexed in Medline. So, and you may be submitting to some of these. And so the last thing you want to do is write up something that you think is new to the medical world and submit it to a journal and have the editor say, we've already published on this, or it's already been published, or have a reviewer just flat out reject it because it's not new to anybody. And another reminder, and I think you guys wouldn't, but don't use non-peer-reviewed information unless you explicitly outline that there is no available evidence on this. However, expert opinion suggests this. And so if you're going to reference expert opinions from, say, chiropractic economics or dynamic chiropractic or other non-peer-reviewed sources, make sure you outline that it's just expert opinion and that it's not coming from a peer-reviewed journal. Editors don't like to see non-peer-reviewed sources in reference lists. And again, cite the references as the journal instructions for authors recommend. So, and you can see that on any journal's homepage. So a couple quick examples, and again, I'm beating a dead horse here, but I just want to make sure that I remind you, if you're searching for something chiropractic related, start with index to chiropractic literature first. And the reason is that's the simplest way to get everything that's been published on a certain topic very quickly without having to search through a bunch of stuff. So I use the example of colic. Let's say you're interested in spinal manipulation and colic. You go to index to chiropractic literature, you type in colic, you'll see that there are 46 articles that are published on colic and anything chiropractic related. If we do the same in PubMed, obviously colic is something that's been researched extensively. And so you can't just type colic and hope to find anything. So you have to come up with a good search. I came up with this rockin' search, colic, and in parentheses, chiro truncated, or in quotation marks, spinal manipulation. So essentially telling the program the same thing. I want colic and anything chiropractic related. And we'll see that PubMed only has 42 articles. So presumably, index to chiropractic literature has 4 articles that PubMed doesn't. I didn't actually go through to confirm this, but I think it's safe to say it probably does. So, but they may be non-peer-reviewed. Everything on the index to chiropractic literature is not peer-reviewed, but nonetheless, there's something here that wasn't here. Now, let's say you come up with this rockin' search, and you know it's going to take you a while to publish this because you're going to be busy practitioners. Make sure you save your search so you don't have to do it again. Moments of genius when you come up with a great search don't always happen quickly. So save your search. You see this little tab right underneath in PubMed, save your search, and you do that by logging into MyNCBI. You don't have to remember your MyNCBI account because now you can log in with multiple user interfaces. So you can log in, if you've got a Google account, you can log into MyNCBI with your Google account. Once you save your search, it comes up with this screen, and it gives you the option of, would you like to have it send you anything new that's added to Medline with these search criteria? And they can have it send it to you once a month, once a week, or once a day. And that way, anything new that's been published as you're working on your case report, you don't miss it. It gets sent to you automatically. And I actually save this because I'm actually interested in colic and chiropractic. So There's an unlimited number of these. So every time you do a search, you can save it, and anytime something new is added, it'll email it directly to your inbox, which is pretty handy. Some of you might be using that, but I'm guessing almost none of you are using the Send To option under My NCBI. So let's say you find a paper that you like. You can create files of papers. So let's say colic and spinal manipulation case report write-up. You call your file that, and then you can send it, any reference that you like, you can send it directly to that file. You can also send it to a bibliography where it's going to automatically create a reference for you, which you can then just copy and paste directly into your paper, provided that the journal you're using is using the same format as PubMed. And this is a big time saver. It's a huge time saver because journals, this was published, the Journal of the Canadian Chiropractic Association. But you'll see that you can't list in a reference the Journal of the Canadian Chiropractic Association. It has to meet uniform guidelines, and uniform guidelines also dictate that journals are abbreviated, and all journals are abbreviated, even if they're a very short journal title. And so we can see the Journal of the Canadian Chiropractic Association is JCAN Chiropra Assoc, right? That's not intuitive. There's no way you can figure it out, so you'd have to go look it up. You have to remember, where do I put colons? Where do I put semicolons? And so if you've got a bibliography that you can just copy and paste, it's much easier. So you can put all your references into Medline, and then you can just copy and paste the bibliography. Very easy. So there's just a couple tips, time savers. So case report, the methods. This is the easiest section. This is just outline what it is that you did. And so it's objective. You just say that, a 40-year-old white female came in with psoriasis. We gave her oral vitamin D supplementation for daily at 5,000 IUs, and her psoriatic plaque symptoms decreased by X amount, as measured by visual inspection with a ruler, and we saw a decrease by 50% in 3 weeks and a complete resolution of symptoms in 6 weeks. That's your result with the method section. So very easy. The case report is simple, straightforward, and it should be reproducible. And this is something that, unfortunately, there's a proprietary technique problem in our what we do, and so you've probably noticed that if you read Graston or Activator or McKinsey or kinesiotaping, et cetera, you very, very rarely see protocols listed in published literature. And it's one of the reasons that they have trouble getting things published is that they don't want to release their proprietary ART. That's a classic one. ART is something that's widely utilized but not published on a ton because they don't want to release their trade secrets for how you do ART. And so if you want to get your case report published, you should list the methods to the point that I could read it and do it in my office. And that's really the point, right? I mean, if you're really going to take the time to contribute to the literature, unless you're trying to brand a particular technique, you want to inform us so that we can reproduce it. So it should be a lot of detail there. Now, the discussion is the only section where you get to insert your own opinion. You get to talk about your own hypothesis or talk about why you feel personally that your case report has contributed to the chiropractic literature or the allopathic literature. So the discussion is where you get to discuss your paper, and it's fun. And you can also use references in your discussion section. So you can say other authors have thought that this was an awesome idea too. And the discussion section is where you can do that. If you get overly opinionated in your discussion section, or if you make outlandish claims, it'll never make it through the peer review process. Because what is the peer review process? Anybody outline the peer review process? Why does the peer review process why does that give something credit?
So through all the evidence, the claims that you're making, make sure everything makes sense, that it could be useful in other people's offices down the line. one case. Enough evidence forward to show that it's worth over again.
Right. So essentially, authors submit to one journal, and the editor says either this is not something we're interested in, or this is something we're interested in. And editors are always looking for good material. So don't think that even if your case report is very detailed and specific, that you can't find the right outlet to publish it in. You just have to find the right outlet to publish it in. And don't be afraid to ask an editor prior to doing any work on something, hey, is this something you're interested in? Email them and say, hey, I had this case of X. Is this something your journal might be interested in publishing? And they'll tell you. So you submit your paper or clinical trial to a journal, and the editor then takes it, makes sure that it matches their requirements for publishing, and then sends it out to reviewers. And the reviewers are all PhD experts in their field, and so he or she will select reviewers that know what they're talking about. Chances are good that they know your topic better than you do. And so they will then send out your paper and say to the reviewers who are volunteering for this and not getting paid for it, and the reviewers will review your paper, which takes time, and they select 2 or 3 reviewers. The reviewers then send the papers back to the editor and say, we agree with this with the following revisions, or I don't agree with the author's conclusions here. And the editor will then at that point decide whether they should move forward with the paper. If they want to move forward with the paper, they then send it back to you, the author, and say, you have to come to terms with all of these independent reviewers, and if you can come to terms with these reviewers' opinions of your paper, make these corrections, we'll consider publishing it. You then send it back to the editor if you can come to terms with the reviewers, and you have to keep in mind you've got potentially very big egos with potentially opposing views. And so you may not be able to come to terms with reviewers' opinions for changes that need to be made. So because they might be opposing each other. Not only might a reviewer not agree with you, but reviewers might not agree with each other, which they don't get to see each other's comments. And so it may be impossible. But you do your best to come to terms with the reviewers. You then send it back to the editor, who sends it back to the reviewers. The reviewers give their stamp of approval, sends it back to the editor, and if it's all copacetic, the editor will then put you in line to have your paper published. That obviously is a very long and tedious process with lots and lots and lots of potential for people's opinions to, or their knowledge of the facts to keep your paper from getting published. So I think upwards of only about 25% of papers that are submitted to journals get published, if that. And I would say speculates that case reports are probably less. So I would guess that less than 20% of case reports that make it to the peer review process ever get published. So the peer review process is not perfect, but it is getting a lot of expert opinion and input into a paper that's not that dissimilar from having co-authors. So the reviewers are essentially co-authors with potentially differing views than the author of a paper. And so that's why the peer review process gives a paper credibility, because it's already been put through the ringer of critical appraisal by multiple experts. And so, and if you write a case report, it's going to be subject to that. So the conclusion is also a little bit challenging, but the conclusion is not that different than the title of a case report. Obviously, the conclusion of a randomized clinical trial might be different, but your conclusion and your title are going to be essentially the same. A couple sentences that state what the case was about, and it's objective and it's concise. And again, a good way to write a case report is have a handful of case reports sitting in your lap so you can compare and contrast what you know, other authors have done, especially if once you found the journal that you want to submit to. So on that note, I should mention, if you want to acknowledge somebody that helped you along the way, maybe a CA, an office manager, another physician, or even even the patient in some cases, if they had to go above and beyond just being a patient to help you write this case, you can acknowledge them there. Anybody that you acknowledge, the journal's going to want to see written consent to publish their name. And it's the same with co-authors. Authors on case studies, there should only be 1 or 2 authors. Most editors would look at 6 or 7 authors and say, did they really help you write this 700-word document? Did 7 people really help in this 700-word document? So keep your authors to 1 or 2. Often what you'll see is somebody who's good at writing and somebody who's a great clinician teaming up, and one person will write the case report as a primary author, and the treating clinician might be the secondary author, and so that's perfectly acceptable. So, if you're in a practice and you're interested in publishing and the other person is a great clinician, that's a good team, but limit your authors to essentially 2. Acknowledge only people that really helped, and again, your acknowledgement is going to take from your word limits, and so writing up a case in 700 words or 1,000 words is actually pretty challenging. So you're going to want to keep your acknowledgments tight, because it's going to take away precious real estate that you have for writing up the details or your discussion. References, again, keep your references to probably between 8 and 20. You don't need a ton of references, and the reason for that is you're only referencing direct correlates to your paper, and your paper's short. So you don't need a ton of references in a 700 or 1,000-word paper. Now, where to submit, and this is what I was alluding to. First, you have to think about, there are over 5,000 biomedical journals, so there are lots of journals out there. But you have to ask yourself a couple questions when you have a case report. Number 1, would the readership be interested in this topic? If the answer is no, then the editor is likely going to say no. And then number 2, does the journal publish case reports? And only maybe half of journals publish case reports. So you have to find out first, does the journal publish case reports? And then find out, is a journal going to be interested in your case report? And so, and editors might not be interested for a variety of reasons, so don't take it personally if they're not. It may be that they already have a backlog of 50 case reports. It may be that they get all their sponsorship. This happens a lot in CAN literature. A lot of editors are running a business. A journal is a business, and so if a journal is exclusively funded by drug companies, we might have trouble getting published in that journal. And there's no point in taking that personally, right? A business is a business. So a good example is Spine. Spine is a very well-respected orthopedic journal that we have trouble getting published in. Even some of the great work that we do at National, we have trouble getting published in. That's not to say we haven't been published in, but if you see a CAN paper published in Spine, you know it's phenomenal, because Spine gets all of its funding from advertising from drug companies and from device manufacturers. And so, and there's some competing political interests there. And so that's why it's hard to get published in Spine. Spine is an example of a journal that doesn't publish case reports. But anyway, select your journal, then contact the editor and say, hey, I have this idea. Again, I would do it before you write up your whole case report, and say, is this something you'd be interested in? And the journal editor will give you the honest opinion, either yes or no. And then it's time to submit. There are copyright reasons why you can't submit to multiple journals, but you can submit, get rejected, and then submit to another journal. But you can't submit to 2 concurrent journals at the same time. Because you sign an exclusive, there's a name for it, but you sign a contract with the journal saying you're not going to publish this anywhere else. And so, but again, if your report gets rejected, you can submit it elsewhere. Once you've got your journal, go to the journal's website, and you'll see this is JMPT, and there's a 4 authors drop-down tab, and so you can find out everything you need to know. They have their own consent forms there, so you can get their consent to publish. You can get their patient consent forms. You can get how to write up all of the different types of research that they accept. And what you'll find there is that they actually have a case report section, but you're submitting to their sister journal, the Journal of Chiropractic Medicine. So Journal of Chiropractic Medicine is obviously a good outlet for chiropractic related case reports. Make sure you proofread, and make sure you have somebody else proofread. Even if you've got a great proofing mind, if it's your original work, our brain has this interesting ability to correct mistakes, auto-correct mistakes when you're reading. And so you've maybe noticed this in your own work before, but it happens all the time where if you've written something, you wrote it wrong in the first place. Your brain is very poor at picking up that it was a mistake because you wrote it incorrectly in the first place. And so always have a second set of eyes preview your work. You have to make sure that it matches the uniform requirements for manuscripts, which is pretty simple, and I think we can all write in that, but their link is live there. And then you also have to make sure that it matches the overall structured guidelines for the journal that you're putting together, which again, that can be tedious and time consuming. So again, I've already talked about the peer review process, and now that I've gone through the process, you can see that this isn't a weekend activity. You know, writing up, from the time you decide to write up a case report to the time it's published is probably a minimum of 10 months to a year. It takes a long time. So this isn't just something that you can take on lightly, and again, it's time consuming. However, it can be very rewarding. Being published is a very cool thing. Not many people can say they're a published author. And advertising this to your patients is great. And again, you could be helping your profession and helping us all out. So that's essentially it. That's writing a case report. If you ever have any questions or you have a case that you think might be interesting, you can always contact anybody in the NUHS research department, and you can always contact me and you know, anybody in the research department. They've committed to research, and so they're eager to help. Not only their plates are full, and so you know, don't expect a rapid response. But if you've got a cool idea that you think would be worth publishing, don't be afraid to contact anybody. The LRC is the same way. They're happy to work with alumni. So don't be afraid to get guidance. Just you know, don't come to us with a completely blank slate. So that's case reports. It's been a fun semester. The presentations this term were excellent, and I learned a lot from all of them. And so that's it for this term. A reminder to the 9th tries, attendance is mandatory as 10th tries. So 10th trimester interns are required to attend as part of clinic requirements. And if anybody comes looking, I think you could get in trouble for not being here. So it's a good educational opportunity, but if for no other reason, attendance is mandatory, and you don't want to not graduate just because you missed a 50-minute session. So we will be back next try. Again, if anybody wants to come check out my clinic in the interim or has any questions, feel free to call me or email me, and we'll see you guys next try. Happy holidays.
Thank you.